So why is it such a big deal, and why is it so important to bring in, in building care to work with older adults?
Yeah, I mean, there's so many important outcomes that come out of addressing people's housing stability and their need for care. Both are key foundations of the social determinants of health. And actually in our state, we are the most economically insecure state to age in the country. And we believe that's because of the twin costs of high housing costs and high care costs, which makes it really difficult to afford to age here well. So not only is combining housing and healthcare an important way to meet the needs of older adults, because 80% of older adults are going to need some help at some point in their life. So looking at housing together with that help is important. But it's also social housing and housing at scale is a way to create community. It's a way to bring wellness to people's lives that is a preventative health measure in and of itself, but it's also an incredibly efficient platform to effectively deliver care to older adults, because it can be expensive and it can be prohibitive, especially for folks living on a fixed income. So there's so many benefits to it. It's practical. It has fabulous economic outcomes for health expenditures, and most importantly, it brings a peace of mind to residents to know that they have a stable, secure place to live and that they can access the care that they need right there on site where they live.
Incredible, innovative. Like, you really don't hear about facilities that are made specifically for older adults that have all of the elements. It's like a little village, right?
It is a little village. We call them our village centers, our program spaces. Yeah. What's extremely innovative, I think, about what 2Life does is we do it affordably. So there are some models out there that have levels of care and have programs and services. They are extraordinarily expensive and primarily out there for the extremely wealthy. And what we do is take that comprehensive nature of really partnering with people in their aging experience, and through innovations in care partnerships and the ways that we navigate resources to bring government supports to our residents, we're able to provide that comprehensive care to people who are extremely low income. I mean, the median income of people who live with us is around $13,000 a year.
Wow. So, I mean, devastating for a lot of people who work their entire lives.
Absolutely. Right? And in this state, you need, different economists have estimated, you need about $60,000 a year of income to be able to afford the basic cost of aging and the basic cost of health care before you even start contemplating the need for home care, which again, 80% of older adults are going to need some help at some point in their aging experience with shopping and transportation and some of the kind of personal care issues that it takes to get through daily life. So you can walk out your door and you can go to our gym and take part in our fitness center. You can go to an art class in our art studio. You can join a book club. You can go to a lifelong learning lecture. You can join the choir or the dance troupe that's self-organized by our residents. And increasingly, as we're integrating healthcare in a way that we call site-based, we have clinics in a number of our buildings now where you can walk out your door and you can get your comprehensive care needs met by seeing a nurse, a geriatrician, a nutritionist. You can get your blood pressure taken. All the labs are done on site. It's extremely convenient. And especially when you're frail, and especially in New England winters, it's nice to be able to have that convenience and also to have a team that knows you.
Yeah. So clearly this setup tackles a lot, housing, healthcare, prevention, preparation. What kind of changes are you seeing now in people's lives because of it?
Yeah. Well, I think probably the best way to answer that question is to tell you a story about someone who I won't name his name, but he's someone who's lived with us for quite some time on our Brighton campus and has had complex health issues for many, many years. And prior to we have a PACE healthcare center on site on our Brighton campus, and prior to opening that center about a year ago, We were able to help him coordinate his care through our staffing model, but that care was remote. That care was a range of doctors and specialists, each of which, in a very siloed way, were charged with dealing with different aspects of his health. But there was really nobody that comprehensively understood him, understood his needs, and were really coordinating his healthcare needs in a way that addressed the intersections and complexities of what he was dealing with. And again, he had to travel to receive that care. So it was complicated, inaccessible, and frankly kind of expensive, because understanding how to pick the right healthcare plan and then utilize that healthcare plan is pretty overwhelming, especially for older adults. So he actually joined our PACE Center when it opened on our campus, and all of a sudden, literally down the hall, he's got a team of doctors that are charged to coordinate his care. And not only is his core chronic disease better managed now, but they were able to understand and detect other aspects of his condition that weren't being addressed or weren't being noticed because of the lack of coordination of care. And they were fairly simple things like managing nutrition, managing blood pressure better. And his life has changed. And he's healthier, he's happier. Prior to diagnosis, he was involved in all of our activities. We stopped seeing him. He's back coming to the gym. He's back coming to the lifelong learning programs. He's got a pep in his step and he feels better. He feels more secure. So it's turned his life around. And I think probably added time in his life, but it's not just the quantity of time, it's the quality of time. And he has a sense of happiness and a sense of peace and calm that he didn't have before, and you can see it. It's dramatic.
Can you share with our viewers where they can learn more about Two Life Communities?
Absolutely, would love to do that. So we have our home base in Brighton. We actually have a very large campus. It's near Chestnut Hill. You can go to our website. You can call us. We're twolifecommunities.org. It's the number 2, the word lifecommunities.org. Look us up. Please call us.
Thank you so much for joining us today.
Yeah, thank you.